previously, during the pre-COVID scenario, everything is administered in person, but we have managed to recalibrate our curriculum. So when we say curriculum recalibration, we actually reformatted the learning delivery for our students for both lecture and laboratory formats. And part of that is to make some sort of mapping for our laboratory and practicum. We do understand that it's very unsafe for our students to do their clinical duties right now that we have this COVID-19. So therefore, we tried to identify what are some of the replacements for the clinical practicum of our students on how we can hone their skills even they are at the comfort of their homes. So as member of the University Center for Quality Management, so I actually created these templates that not only the College of Nursing can use, but of course, all the colleges in our university. So we are very lucky and fortunate because our university administration uh, purchased our subscription to our learning management system 3 years ago. So even during the pre-COVID scenario, we already have our learning management system. But I tell you, only 40% of our faculty members are utilizing our Canvas learning management system. So right now that we are in the COVID pandemic, so they have no choice but to embrace these technologies. But we already have some faculty members who are expert in terms of the development of their learning resources, of course, at Canvas. So in developing our learning resources for the independent learning of our students, so we should consider several standards that sharing of the intellectual property of universities prohibited, okay, and compliance to data privacy, and the use of copyrighted contents is illegal. So we need to ask for permission if a learning resource is copyrighted, of course, or not. And I also consider that, for example, right now that everything is virtual, it's very much important for us to give some announcement to our students so that they will feel that there's a teacher presence. So for example, in our learning management system, we have here an announcement feature. So we always announce to our students what would be the expected outputs for that particular week. Because based from a research that I conducted in our university, faculty members who are using regular announcement or reminders to students are 71% more likely to receive an outstanding evaluation. So announcement is very much important. It will make our students feel that there's really a person, an educator who's actually assisting them, giving them guides and giving them instructions on what to accomplish for that particular week. So part of knowing our media as a very valuable concept in developing impactful learning for our students would be to consider that learning is effective if you're going to stimulate a lot of senses for your students. Because based from a very old adage, tell me I might forget, show me I might remember, involve me and I understand. So therefore, if we're going to develop, of course, activities for your synchronous sessions or learning materials, there should be a material where the students can see, can hear, can view, or experience. So for example, we have applications nowadays, and later I'm going to share to you some of them. There are applications that we can use for our students to immerse themselves into that particular experience or to that particular skill. And featured on my slide would be some of the teaching designs that I'm using for my class for both synchronous and asynchronous. So knowing that nursing is a skill-based profession, so I do a lot of course, demonstrations online using the applications that are available. We also are doing what we call discussion boards because that would be very useful for our students, for us to know that they are active in the course. And I use the following softwares for both synchronous and asynchronous sessions. Okay, requirements. As nurse educators, we need to comply with certain requirements. And based from an article that I have previously published, I call this the technical and the technical requirements. Okay, so when we say technical requirements, we are talking about technology-related requirements. And when we say technical requirements, it refers to what are the values or traits that our faculty members in the College of Nursing must have. So for example, I know you don't have any problems on this. You should have the latest operating system for most of the current applications to work. If you're using mobile phones, you need to have the most updated, of course, the operating system for that. Your computer speed, you should have a minimum of 2 gigahertz. And as mentioned by one of our participants here, the capability of the device is very much important. Yes, because you cannot use other advanced tools if your computer cannot, of course, operate on that. So I would suggest that you have 1 GB of random access memory for those of you who are very much technical, 2 gigahertz of processor, okay, and internet speed of minimum 512. So for the technical, you should have uh, skills in developing your learning resource using the document processing software, just like the Microsoft Office Suite. You should have the competence to develop your learning materials. As teachers, we need to be committed to our students. Okay, we need to monitor our students' progress. We need to update them on their performance. And as much as possible, if we can monitor them online and give reminders to our students. And you know what? For me, I always set some sort of limitations for my students because I have students who are texting me at 11 p.m., right? So it's very much important that you set, for example, students, you can ask any questions for me asynchronously. You can text me, you can call me, or you can send me email between 8 a.m. to 6 p.m. And beyond that, so that would be your personal space. That would be your family or your family space. So we need to be committed educators. Second, fourth, we need to, of course, know the value of communication. We need to communicate with our students because we don't want them to be left behind or working on their own all throughout the learning process. And for compassion, this is very much important. You should have a compassion for your students. You should own your students as if they are your own kids, right? With that, you will be able to give them the best. You need to care for their learning process. You need to ensure that they're learning something from you. Okay, and it's also very important to consider some activities that might be using a lot of data. And here on my slide, on the right portion, I actually divided several activities that we might be doing online and how much data will it consume. So for example, so low data requirements would include instant messaging, email with attachment. It really depends on the attachment. And research browsing. So for example, researching from the internet using Science Direct, etc., would eat up around 200 to 500 MB per hour. And the most data intensive activities would be the synchronous sessions, just like this one. Okay, so I conducted a research again as a researcher. So what I'm doing in class are actually research-based. So I conducted a research on what are the data requirements for my students and how big data are they consuming for each of the activities that we're having in class. And I found out that synchronous conferences and uploading videos that are around 1080p would consume a lot of their data, especially if, for example, if their devices are not that good. So it will not be effective if you will be uploading 1080p of video. So one of the policies that I actually implemented in my college would be, do not upload videos that are 1080p. As much as possible, for your students to have a very seamless streaming of your videos, you need to, yes, that's correct, 720 or 460p. Okay, but from my experience, 480 would be good enough for the students to understand and to clearly see the videos that we prepared for them. Okay, so plotting this up, okay, so for a 3-unit course, these are some of the common activities that my students are doing. And before the semester, I actually urge them to test their internet speed, especially before our synchronous session, to ensure that they are having good connections, and they will not cut up during our synchronous sessions. Okay, so now that we are working remotely, it is very much important also that we orient our students on some of the, of course, resources that they can browse from our university website. So for example, it's very much impossible for them to visit the library. So it's very much important for us to orient our students prior to the start of the semesters that they can access some of the resources from our university library website. So that would be very much important because we have students who would like to go beyond what we are teaching them. They would like to explore more on the topics that we are teaching them online. So it's very much important that we share how they can access online learning resources. Okay, so these are some of the recommendations. But the question is, how can we make our students engage? Now that we are prepared in terms of our resources, our devices, and technology connection, the question would be, how can we make them engage in the learning process? Because during the in-person classrooms, some of our students are not engaged, right? So there are few of our students who are still texting in class. Some of them are not paying attention to the teacher. So it's very a challenging task for our students to make our students engage inside the classroom. However, now that we are in this virtual learning, it is more challenging to make our students engage. So as a researcher, I reviewed hundreds of publications on how we can make our students engage. And I found out a very eye-opener formula on how I can make my student engage in my discussion. So I called it a deep dive in understanding positive student experience. So we need to identify how can we make our students engage in our instruction. So we need to consider three important things. Okay, these things, if we master these three things, okay, we can master student engagement. So are you ready to know what are these three things? Okay, engagement dimension number one. As educators, we need to master the behavioral aspect of engagement. So when we say behavioral aspect, I'm talking about participation of our students. So we need to make them participate in our sessions, not just watching synchronous sessions. So that's the reason why before I start my discussion, I ask you to answer a certain survey. I mentioned that you can chat your questions because I want to make it more interactive. I want you to participate, not only listening to me, just like I'm in a television and you're watching a movie, etc. So if you want your students to be engaged, you need to tickle their behavioral aspect. You need to make them participate. So what does it mean? You need to create activities online that will make them participate, not just listening to you. And philosophically, I call it the hands. Okay, the hands dimension of engagement. Second, I call it the affective dimension. So if we want our students to be engaged, we would like to tickle the interest of our students. So meaning we would like to infuse joy and excitement in everything that we teach our students. If our students are not happy, if the students are not excited on what we're teaching online, they will not be engaged. So meaning you need to make your activities and your delivery very much interesting and unpredictable. Because if you're a predictable professor, your students will be bored, right? So I call this the hard component. And the third one has something to do about the cognitive process. If we want our students to be engaged, we need to stimulate their thinking. And I think this is the very reason on why they are learning. They are admitted in our university because they want to learn something from us. So we need to maximize their learning capacities. So we need to implement what we call the multi-sensory learning or repetition. If we can repeat a certain concept, that would be fine. If we can stimulate their senses, not only telling them the concept, but preparing a video for them to understand and giving them, of course, activities in a certain app that they can immerse themselves in the process of learning, that would be fine. So I call this the mind component of engagement. Again, if you want your students to be engaged, you need to master three things. First is the behavioral, or the hands. Second is the affective. You need to make your students excited. I call it the heart. And you need to make your students learn. And I call it the mind. So we need the three important aspects. So first on the experience, first we should talk about the cognitive first, because that is the very reasons on why we have our students. Because they want to learn. How can we make our students more absorb the learnings that we're going to offer them? So again, so we need to prepare our materials comprehensively in such a way that all of their senses will be stimulated. Again, you need to prepare videos. You need to prepare modules that they can read. You need to record your audio or podcast for them, for some of them who are auditory learners. And we need to prepare activities in class, may it be synchronous or asynchronous. So you also need to consider the level of knowledge that you want to impart to your students, because we have lower order thinking skills and we also have higher order thinking skills. Okay, so in the field of education, we have what we call sensory learning, or the picture superiority effect. If you're going to add more media dimensions into learning, this will be more effective, of course, to them. And one of the challenges for our educators that I have noticed during the initial implementation of our flexible learning, some of our students are very much bothered on the number or amount of information that are given to them. Okay, so the question would be, how many how many resources are we going to prepare? How few resources are we going to prepare every week? Because our students might have this information overload. So that the advice that I can give to that would be summarized in this particular slide. It says, non multa sed multum. So when we say non multa sed multum, it has something to do with the importance of quality over quantity. The amount of information or resources that you're going to offer to your students will not be tantamount to the amount of learning that they will absorb. So meaning, if you have few resources, but if they are in good quality, they are carefully prepared, so this will be, of course, effective to our students. Okay, I have some comments here in the chat box. Okay, I have some comments here in the chat box, and later I'm going to share with you on how I create these slides, these interesting slides. Because again, if you stimulate your viewers, if you stimulate your learners, learning would be more effective. If you make your slides unpredictable, learning would be more interesting. We also need to consider that not all cool are effective, and we need to prioritize pedagogy before technology. So for example, there's a new technology out there. Some of our educators would want to implement that right away because these technologies are cool, these technologies are wow, right? But we fail to understand that there should be a strong link between pedagogy and technology. It's not enough that this technology is recent, this technology is cool, so we need to apply it. No. So you need to consider first pedagogy before technology. Okay. The next dimension would be, again, the hands. For us to make our students engage, we need to elicit participation to our students. Okay. So for example, in my class, I'm doing online Bring Me. Okay. So I'm doing online Bring Me for my class to make them interactive. Okay. So I also do have this what you call the online kickoff sessions. Okay. I make my discussions really engaging. Okay. I utilize different sounds. I utilize a lot of assessment tasks and tools. Sometimes I group them. okay, for them to create or to develop a certain output. And we should also establish what you call the online presence. So when we say online presence, we need to communicate and collaborate with our students. We need to communicate and collaborate with our students. So in the nursing profession or in the field of nursing, there are actually lots of tools that we can use. Okay, so for example, in our university, we are subscribed to some of this. We have the Person My Love Nursing for nursing procedures. I also invite guest experts sessions because I have lots of connections around the world working in different areas of nursing. So sometimes I ask them to be my guest in my class to speak about a certain disease or how they manage it in the hospital for 30 minutes, 20 to 30 minutes, and let the students ask afterwards. So for them to make them feel that it's really possible to learn clinically even during the pandemic. So for my personally made videos for nursing procedures, I use Flipgrid. Flipgrid is very much effective. And if your university have subscriptions to Labster, this is also very much effective. Okay, so at this point, I would like to share with you some pictures of my online class and how I make it very much interesting. So these are some of the activities that I'm conducting in class. Okay, so we have a lot of animations going on, and we have lots of interactives that I'm introducing to our students. I do demonstrations for them to understand a certain concept in terms of, for example, the lung sounds, the heart sounds. And prior to the pandemic and during the pandemic with social distancing, we also created, of course, videos in our laboratory for our students to watch. Okay, so you need to make your students uh, involved, especially during the instruction. You would like to make them active during your synchronous session. So one of the things that I'm using every now and then is the Mentimeter application. So the ones that I used initially before I start the discussion is Mentimeter. So Mentimeter is an interactive presentation for meetings, right? So just like, for example, online classrooms. So I use Mentimeter just to know the pulse of my students. So I ask them a certain question prior to the start, if you know this concept, etc. And this is how you create that. So you just sign up with Mentimeter. You can explore on this later. Okay. So what I love about this is you have different options that you can utilize. Okay. You can do ranking. You can do type and answer. But I love word cloud. Okay. I really love word cloud. So for example, prior to the start of introduction of the new concept, you can ask your students, just like this one, how will you describe nurses during the COVID-19 pandemic? Okay, you need to prepare that before your synchronous session. Then after that, you need to share the details to your students. And once you click present and the students are start answering, you can see their answers popping on the screen. So it makes it more interesting. Okay, I use this especially during ethics in research class, especially for those scenarios that are really, of course, controversial. Okay, another thing that another application, an online application that I can recommend to you would be Perusal. Okay, Perusal is also free. Okay, but if you would like to use the advanced options, you can. It has some sort of subscription, but just like Mentimeter, Perusal is free. So Perusal is a social e-reader. So if you have an article that you want your students to collaboratively read, okay, so you need to sign up for Perusal. Okay. So you need to sign up for Perusal. Okay. So for the Mentimeter, how will the answers pop up? So if the students actually input their answers and send it, so you can actually see on the screen the responses of the students. Okay. So Perusal application. So Perusal applications, again, is a social e-reader. So how are you going to go about it? So you need to sign up with Perusal. Okay. So there are some information that you need to fill up. You just need to explore on this later. So for example, I'm teaching nursing informatics right now this semester. So for your institution, this is very much important. If you are an administrator in your university, for example, if you are the dean or the head or the coordinator, you need to email perusal to include your university. Okay, and this is free. You just need to email them. Can you please include our university on the list of institutions with free access to perusal? Then they will just respond. Okay, then after that, you need to click on several settings, just like here. So for example, I would like to upload a certain article for my students to read asynchronously. Okay, I just create on a certain task. Okay, so add a certain document. So for example, a nursing procedure perhaps. You want them to read this before attending the synchronous session, so you can do that. Okay, and once you upload it, you need to share it to your students. So you need to add the email addresses of your students, and you will give them a code that they can use for perusal for you to for your students to access the course. Yeah. So you just input the course code for that. Okay, so this is what perusal will look like. If you uploaded a certain article, your students can actually comment on certain paragraphs, on certain words, etc. And you can challenge the critical thinking of your students by asking them how did they come up with that particular observation. So this is very much useful, especially in research class and procedures in the laboratory for your students to identify why is this step very much important, etc. Okay, so another thing is we need to heighten the interest of our students, and that's the heart component of engagement. We need to infuse joy and excitement to our students. Okay, if we can gamify our discussion, okay, if we can do games during online learning, and after that, they will receive some sort of badge, electronic badge or recognition. And I tell you, this is very much effective for the students. And once they receive a certain badge, they actually flaunt it in their social networking sites. It means that they are really happy about their achievement if they receive some badge from an activity that they usually accomplish. Okay, so for here, okay, I'm going to share with you some of.
Okay, so we are going to have some music.
Okay, so.
Okay, Ma'am Muji.
Ayan. So these are some of the technologies that I'm using in the classroom. Okay, pre-COVID and during COVID. So I use gamification. So if you are familiar with TikTok, if TikTok is okay with in Oman, okay, I use TikTok dance for the students to understand some of the concepts anatomically. Okay, so I'm going to play that.
Okay, so we are going to have some music. Okay, Ma'am Muji, Sir Sanyo.
Okay, so I'm using TikTok for the students to understand how to place electrodes. Okay, and I also use lots of technologies, okay, that I'm going to share in the next few minutes. And it's very much important for your class to maintain a group outside your learning management system. Okay, so for here, I am creating, of course, a group for my class so that they can collaborate and coordinate if they have questions. It also serves as a discussion boards. So every now and then, at this particular Facebook site, I'm posting lots of videos for them to be excited on my class, just like this one. So I create a walkthrough videos just like this one, especially for those students who are having challenges in accessing their using technology. And another thing would be to create an excitement for my students. I'm creating some sort of prepare videos. something like this. I'm creating some sort of this videos for my college, and we're posting it at our Facebook, of course, Facebook groups. And I think during this kind of the pandemic, it's very much important for us to explore on other technologies that might be, of course, the trend of the future. And I'm talking about technologies in the fourth industrial revolution. Okay, so just like for me, as a researcher, I'm working with lots of robots for research, for education, etc. But the fourth industrial revolution is not only about robots, but it's about the use of virtual reality and augmented reality. So in your class, you can use augmented reality and virtual reality. And these are some of the examples. So for example, in anatomy, okay, so the first one, so maybe I can post some of the videos. So the one that's playing above is what you call the augmented reality. So when you say augmented reality, so you can actually show a certain model for your students, for example, anatomy, okay, by using only the camera of the cell phones. Yeah, okay. So you can actually maximize the heart. And there's actually sounds that you can hear, okay, if you're using augmented reality, okay. Yeah, so that's the first one. The second one is what I'm using uh, in my graduate school class in the Philippines, ecology of disasters, okay. So I downloaded this particular app, augmented reality also, on how disasters occur, man-made disasters, okay. So I can put there some clouds, I can make it rain, right? For the students to understand the concept on how disasters will occur. And they're also, these are actually free. And there are also augmented reality that are embedded within Google. Okay, so for example, I can have a dog appear, okay? I can just do what you call, yeah. So I can make a dog appear there. This is especially for veterinary medicine. And what I love about fourth industrial revolution educational tools would be artificial intelligence. Okay, as a researcher, as an enthusiast of technology, I'm actually using artificial intelligence in my pad. So for example, the light here in my pad is being controlled by artificial intelligence. And this is Alexa, example. Alexa, lights off. Okay. Alexa, lights on. Okay. Alexa, what is the treatment for COVID?
According to First Data Bank, treatment for COVID-19, also known as coronavirus disease, includes rest, fluids, non-prescription drugs such as fever reduction.
Alexa, what is the weather for today?
Currently, in Commonwealth, it's 80 degrees Fahrenheit with mostly cloudy sky.
Stop. Alexa, who is Florence Nightingale?
According to Wikipedia, Florence Nightingale, OM, RRC, DSTJ was an English social reformer, statistician, and the founder of modern nursing. Nightingale came to prominence while serving as a manager and trainer of nurses during the Crimean War, in which she organized care for wounded soldiers.
Okay. So I'm actually using Alexa, especially in the history of nursing. So what I'm doing is I'm uploading an article at Perusal that my students would read prior to attending our synchronous session. Then after that, so I have this game called Ask Alexa, Beat Alexa. So first, I'm going to ask a certain question. Okay, I'm going to ask a certain question.
I didn't catch that. Please say that again.
So I'm going to ask a certain question to this machine. Okay, then I will let my students answer first. Okay, what do you know about Florence Nightingale? So the students will mention. Then at this point, I would like to ask our machine here about Florence Nightingale. So we're going to check the boxes on how extensive the information are provided by artificial intelligence. So I also use this for my nursing informatics class, and this is of course very much exciting to use. Okay, so I use lots of badges. Okay, you can actually create this online. So for example, I call it the dignified badges. So I call it the dignified badges. For example, if you pass an examination, I'm going to give you the green badge. Okay. If you, for example, submitted a laboratory output, I'm going to give you the purple badge. Okay, and my students are actually posting it online. So I call it the dignified badge. Okay, I call it the dignified badge. Okay, so another challenge for us educators would be assessing our students. But of course, before we understand assessment, we need to identify that assessment actually occupies a very large literature in nursing education. And for me, as an educator, as a nurse educator, I'm utilizing the concepts of Catherine Biggs and Tang, okay, under the roof of outcomes-based education in assessment. So regardless whether it's in person or online, okay, so I'm using outcomes-based education for assessment. And as we all know, when we say outcomes-based education, it's not a method, syllabus, design, or subject. It's actually an approach, not only in teaching and learning delivery, but of course for assessment. So in designing assessment for our students online, we need to understand that outcomes are the determinant of teaching and learning activities. So outcomes are the determinant of teaching and learning. So we need to consider our outcomes before we can decide for our teaching and learning approach. And we need to also identify our outcomes before we can check the learning, of course, the assessment of learning for our students. Okay, how about for those laboratories? What are some of the acceptable replacements for that? So at this point, I would like to share with you some of the things that we're doing. Okay, so we need to change our mindset about assessment in virtual. Okay, because before we assess knowledge, skills, and attitude. Now that we are online, we are assessing reasoning, resilience, and responsibility. So for laboratory tasks, your university can also create this what you call the laboratory packets. For the materials that cannot be accessed by your students, okay, in the laboratory, you can actually share, you can actually send that to your students through the learning packets and let your students do a return demonstration by recording a video of themselves. So I think I need to play that. Okay, so I think it's not working, but that's a video of my student uh, doing demonstrations of hand washing. Okay, so you can ask your students to submit a 30-second video, for example, on how they create this task, a 30-second elevator pitch. And during synchronous sessions, I also am using this kind of roulette, online roulette, okay, for me to, okay. So I'm actually using this roulette for my class. For example, if I have questions, I'm going to spin this roulette and I'm going to call the students who will respond to my question. And for the examination, academic integrity is very much important. Okay. So you can actually create multiple choice questions online using Google Form or your learning management system, but make sure that your multiple choice questions are not objective type of questions because they can easily search that on the internet. So you include questions that are related to authentic functions of a nurse. So meaning, so it might be scenario based, it may be based on uh, a certain problem in the clinical area. Okay, so but for most of the universities, when we started our flexible learning, so we are utilizing also what you call the Zoom sessions to monitor our students. But right now, we will be piloting on the Respondus software. The Respondus software is the browser locked locker software. So when the students are doing their assessments, you can actually lock the browser so that they cannot access any of the online learning resources. So in assessments, if they accomplish something, so I'm creating this badge. So just like this one, okay, this badge is provided by badger.com, and this is free. Okay, you can create your own account. So you can actually create badges, your own badges, for example, most active student. Okay, so you can give this to your students electronically to their email addresses. Okay, so that's it. These are some of the, of course, best practices that I'm using in my class. But still, you can contact me if you have any questions on this is the concept. How can I deliver it effectively to my students? How can we make it more engaged? So I'm very much, of course, willing to answer your queries regarding that. Okay, so with regards to our question, our intended learning outcome earlier, how can we foster flexible learning enrichment and enhancement towards better engagement and learning experience for our students? The answer would be, again, to foster enrichment and enhancement, you should know your students, you should know your course, you should know your media, and know your resources. For you to make your student engage in the learning process, you should consider the caput or the cognitive for them to learn, the core or the interest. You need to incite joy and excitement, and the manus or the hands involvement. You make them active in their learning process. So these are actually coming from the organization that I belong. We call it the Caput Core Manus. And I think this is also important in nursing education. Again, if we want to be successful in teaching our students, we need to consider three important concepts. The concepts of the caput or the mind, the concepts of the core or the heart, we make our students passionate about their learning, and the manus, or you may make our students active. And overall, educational leadership and teachership in flexible learning environment is a combination of your approaches in caput, core, and manus. So at this point, I would like to share with you some of the parting quotes. The best teachers make you fall in love with the course. And I know all of us are former students, right? And for us, we do understand that the best teachers make you fall in love with the course. But I say the best teachers also fall in love with their teaching. How can you assess if you will be effective in online learning? If you are falling in love with what you're doing, you will be effective. If you are excited to do your synchronous sessions, it means that you are prepared. It means that you would like to impart to your students a lot of exciting things, right? And taking a look at your responses, what are the core qualities of an educator in this pandemic-stricken virtual environment? So these are some of the responses, not only you, in addition to the teachers that I, of course, asked before. So if you have any questions, you can just email me, but you can also subscribe to my channel. I have a YouTube channel, okay? This is my channel, Dinified. Okay, this is how my channel looks like. So this channel, I always upload here every week some of the tips and tricks for my students, for my faculty members on how they can navigate online learning. Just like, for example, this video that I'm playing right here, I'm actually demonstrating how I can record my PowerPoint presentations. Okay, so that the students I can upload it on our learning management system, and our students can access it anytime that they want. Okay, I want to share with you this very engaging quote from Steve Jobs. According to Steve Jobs, technology is nothing. What is important is that you have faith in people, that they're basically good and smart, and if you'll give them tools, they'll do wonderful things with them. So meaning, it's not the technology, but the teachers who are using them, right? The effectiveness of technology will be dependent on how you use these technologies. And my last parting words uh, came from one of my favorite novels from Dan Brown, The Origin. And I would like to share this to you. May our philosophies keep pace with our technologies. May our compassion keep pace with our powers. And may love, not fear, be the engine of change. TLC. Tender, loving care. Okay, TLC. Time, love, and commitment. And for our nurse educators, TLC would mean teaching, learning, and communication. Thank you very much, everyone, for inviting me and giving me the opportunity to share my, of course, experiences with you, my co-colleagues in the nursing profession. Thank you, and these are some of my references cited. Thank you very much.
Thank you, Professor Michael. That was really interesting presentation. We enjoyed it a lot. And we have learned a lot of things from you, especially in terms of those things that we can use for students, how to stimulate them and how to make them engaged with new technologies. Now I would like to ask my colleagues if they have any question, they can raise it, please. So I will mute my sound. So if anybody have any question, please, you are allowed to talk now.
I can see messages here of thank you. You're very much welcome.
If you wish to ask a question, you can type in your question here at Zoom chat box so that we can direct it towards the speaker, Dr. Michael.
Okay, Dr. Michael, I probably will be the first one who asks a question. Maybe that will stimulate also other faculties to ask questions. You talked about the examination and how we can do like Zoom examination where we can actually do like kind of like invigilating and we can see the students doing. Because we see we are planning to do something like that. For us, it will be a first time doing it. And we were thinking about, you know, we have some students who are savvy with technology. So what they can do is probably when we are invigilating, they might be opening several pages in their computer while we're taking an exam. So do you have any suggestion of how we can reduce that from happening? Like,
okay, that's good. Actually, the picture that I showed you earlier would be our initial attempts on how we can navigate online assessment in terms of the examination. And we actually found out that there is a more effective approach on how we can administer our examinations. Okay, three important things. First, the quality of your exam. Don't make your exam super objective in such a way that the students can see the answers online. Okay? So you need to create multiple choice questions that will really stimulate the critical thinking of your students. Okay, so that's number one. So it really depends on how you create your questions. So you make your questions ungoogleable or unsearchable from the internet. Okay, number two, instead of using Zoom, we found out that using Respondus would be more appropriate. Because, for example, if you're using Zoom and the students have more than one devices, they can actually access the device. They can actually access the device while they are as if they are just engaged on your examination. So Respondus is a very good application that you can use because it can be integrated or stand alone during your examination. So using Respondus will utilize the camera of your students, and before they start the examination, they need to take several pictures of themselves because Respondus utilizes some sort of artificial intelligence for them to detect if there's a change in the environment. Another thing is that Respondus will require you to scan your environment, your desk, your environment to see if you have, of course, resources that are actually there. Okay. But of course, again, the most important is number one, the type of your question, right? If your questions are not searchable or Googleable, and it will really, of course, stimulate what the students have learned from the past several weeks. So that would be, of course, very much effective. Okay. And number three, you need to recalibrate your grading system. If before you give a lot of emphasis on major examinations, in online or virtual, there should be
Task-based.
minimal component. Yeah, it should be task-based. So instead of you getting your grades from your students based from the examinations that you're not 100% sure that they are the ones doing the examination, you make it task-based. You require your student to submit outputs and create online portfolio. So for example, on my class, 60% is for 60% is for the output, or what I call the course task. 10% is for the midterm exam. Another 10% would be for the final
Participation.
examination. Yes. Participation is the another 10%, and another 10% would be for their capstone at the end of the semester. For participation, I'm a little bit lax for my students, because here in the Philippines we have problems in terms of internet connections and devices. So I don't require my students to
Same
attend
here.
my synchronous session.
Same here.
My synchronous session. Why? Because some of them might have problems. And as a teacher with a compassion and concern to my students, I need to recognize that there will be technical problems that might arise. So what I'm doing is I record my synchronous session. Good for the students who are attending my synchronous sessions because they can participate lively. But for those students with problems in terms of their internet, they can actually browse the recorded presentation later on. Okay? So I think
Same
we
here.
need to be more concerned to our students also, because this COVID pandemic will not only disrupt education, but it will disrupt the emotions, psychologies of our students as well. They might be going through something. They're actually into this what you call denial period, that of course previously I can see my classmates, I coordinate with them, I eat lunch with them, etc. So they might be experiencing a lot of that. And we have lots of course cases in our university for students who are having some sort of a breakdown or anxiety. So student support is very much important.
I agree. Thank you, Dr. Michael. And we are thinking of so many other ways. And it's not just to pressure the students in like trying to take the traditional classroom into a technology, like transferring it to technology. No, we are actually trying to go out of that and start thinking out of the box and see what we can do with the technology to help our students to be engaged. But thank you for your answers. And of course, we will take some of these suggestions into consideration. Now I will open the floor for other teachers.
That's really impressive. That's a good way to start the Q&A. Yeah.
Okay. Thank you, Mr. Michael Joseph, for your wonderful presentation. I have one question. Actually, you discussed so many applications, so I just want to know: is it possible to merge with the Zoom, your application, what you discussed?
The applications to integrate it on Zoom.
Yeah.
Most of the applications are standalone. Standalone, and majority of these applications can be used synchronously or asynchronously. So I think Zoom has limitations in terms of integrating this, but you can easily switch your screen from your presentation to this application seamlessly using the Zoom application, right? So 1 hour is very limited. I have lots of technologies that I can share. So maybe you can just, of course, send me an email, or you can subscribe to my channel so that you can be updated on what are some of the applications that I'm exploring that might be effective on my class that I'm sharing to everyone.
Okay, thank you so much.
You're welcome.
Do we have any other further questions? I think majority of us are
Good
actually.
evening, Dr. Glenn.
Sir Monty.
Okay. Good evening. Good evening to everyone. Thank you, Professor Michael, for a wonderful presentation. My name is Mr. Monty. I'm from OCHS Ibri, Al-Dahira. I just want to ask, sir, because right now I'm alone teaching pharmacology, and right now
Yes.
I'm teaching them the calculations, and the problem is,
Okay.
yes, of course it would be online. The exam would be online. Can you give me an application on which I can have, or the students can show their solutions? Because what we are using is Google Meet, Google Classroom, and in Google Classroom, it's a limit. Of course, if it's calculation, it will be very hard for them to type the solution. The students can only just give the answer, and the problem with that, there will be chances of cheating, asking, texting their classmates. So, is there any good application for pharmacology, especially if it's calculation?
Okay, so that's a very good question.
Yes.
Okay, so in terms of teaching pharmacology, so since we are virtually, so I think I need to suggest the use of the course task. So you can also create this what you call question banking, wherein, for example, if you will be having, for example, this computation activity to your students, you need to ensure that some of your students cannot copy from one another by giving a different set of questions. So, for example, in terms of the computation for pediatric dose, maybe you can give them a different scenario. Okay? So that is very much challenging to our teachers beforehand because they need to prepare a lot of questions. So, for example, the topic would be pharmacology, so IV medications, okay, pediatric dosage, adult dosage, okay, calculation of grams, etc. So they prepared a lot of questions and scenarios that they can distribute to students. Okay, that they can distribute to students. So, for example, I'm answering a pediatric dose question, but this is different from a student in my my classmate, right, in the class who's doing also pharmacology. Yeah,
because that's the only thing that I'm worried about because of the examinations that they will have this coming, I think, 2 weeks from now. So what I just because in Zoom, the students in our case, the students here, they don't like Zoom. They like Google Meet. And then Google Classroom, because the problem here, they were complaining that Zoom has the audio problem. So that's why I'm looking for another solution, how they will show the solution for the online examination of pharmacology. Actually, I was thinking of just using the WhatsApp application, just take a picture and then send it to me.
Yes, that's actually possible, but I think we really need to revisit our objective. So, for example, what would be our objective for a certain topic in pharmacology? For the students to effectively compute for the appropriate dosage for the patient, right? So we can have it asynchronously. We give a certain scenario, we let our students compute, then after that, we ask our students to submit that. Then we create some sort of notations if the answer is correct or the answer is not. I know this is quite an additional task for teachers, right? Correcting different papers, unique papers per student, but I think that would be the most effective. But if you're going to utilize Respondus in your School of Nursing, in examinations, so the academic integrity will be heightened because during the examinations, okay, so the student will be able, should scan the environment first. So that for you to make sure that there will be no copying, there will be no someone who's taking the exam in of course as a replacement for that particular student. So respondents would be very much effective, especially for computational. And I need to mention this. So for some procedures, we do some sort of online demo. So you know Zoom applications, it has a breakout session, right? Okay, what we're doing is we collect our students first in the main room. Then I have 5 teachers who are located in each breakout room. Okay, then, so I'm the moderator. Okay, I assign the students one by one to each of the room where there is a clinical instructor who can ask them question verbally, and they will answer actually directly. So we call that the online Zoom Revalida. Wherein, for example, okay, so this is the grams. You're going to convert it into milligrams, and the patient is weighing, and the BMI of the client is that. So please compute. So the student will compute and will describe to you. So how did you come up with that with that answer? And that would be very effective. We use that for ECG reading. Okay, we use that for other procedures in nursing as well. And this is very much effective. And I think that would also be applicable for pharmacology, which is a very important course in nursing, right?
Yes.
Okay.
Thank you,
Thank
sir.
you for
Thank
that
you.
question.
No,
okay.
Thank you so much.
I have a question, Professor Michael, for you. Maybe regarding the adult health nursing. Actually, we have a student who haven't been to the hospital or to the practice. They haven't been going to practice. So I'm teaching them now adult health nursing, which is a very important subject where the students should have seen a patient or should have dealt with a patient or have seen a hospital setting. For example, now I'm teaching them the operation theater and how it is done, what is the care required from them, preoperatively, intraoperatively, and postoperatively. So it is really, really difficult to explain to the students something that they haven't seen before. So what I did is I just send them videos for those, but I don't know whether you have any application that could help me in that, or could at least help the students or reintroduce the students to the clinical settings, or help them to engage in a clinical setting to understand me much better.
Okay, so very good question. Very good question. Because that is our challenge before. How can we, of course, teach these concepts that are usually taught within the clinical settings? Okay, so we have several replacements for that. So number one, so we are very much fortunate because in our laboratory, we have a very comprehensive visual laboratory for nursing. So our laboratory in our university is in the setup of a hospital, and we have high fidelity mannequins that actually respond to a certain scenario. So first, we record videos for that. Okay. Number two, the use of concept mapping. Okay. So concept mapping is very much effective, especially for procedural nursing, for procedural nursing concepts. So what we did is we created actual clinical case scenarios in collaboration with other members of the healthcare team in our curriculum development team. Then after that, we created templates that the students can use to critically analyze every phase of the student course in the ward. Okay, so that template is very much important. And how about the practice component part? So we partnered with a certain with a certain hospital in the Philippines, of course, considering data privacy, confidentiality, etc. So we partner with a certain hospital in the Philippines wherein there's a video at the nurses station where the nurses can report to that video and the students can log in to see the streaming of that video, and the students can ask anything about the nurse who were actually in the hospital having their duties. Okay, so that's additional. And another would be the expert session. So when you say expert sessions, so we tap our alumni. So we have our alumni group, and we ask the assistance of our alumni, who are you are working in the medical surgical ward? Who are you, who among you are working in the pediatric ward? Who among you are working in the operating room? Okay, then we request our alumni to share their experience to our students on how to manage a patient, for example, with myocardial infarction. And there, we gave them the template for the presentation. So first, you need to present yourself. When did you graduated from the university? Then, what ward are you assigned in? Okay, so you give a specific case. So, what did you do to manage that case? Okay, then after that, with matching pictures, because we have some devices or some instruments in the hospitals that, of course, we want our students to see. And it's very, we're very glad that our alumni are going beyond what is expected of them. Some of them are videoing themselves, touring, having a tour at the hospital, with, of course, with the permission from the patient, etc. And they're actually giving their video diaries on how they do it. So I think we can use that for that scenario. I actually tried an online application before, some sort of similar to a cartoon, when there is a scenario and there are some questions there. For example, what would the nurse respond to this patient if the patient asks something about this? But I think that is not effective, because the software is very much glitchy. Okay, so instead of the students learning, is they will be bothered about the glitch and the bugs of that particular software. But I find we found it very effective, the use of our alumni who are actually having their duties in the hospital as nurses, sharing their experiences, daily experiences, and how they do that. So these are very much effective. I think on my YouTube page, I have uploaded 2 examples of our sessions with the alumni. Okay, our alumni sharing their experiences, and at the end of their session, they're going to discuss a certain topic. For example, how to assess the risk for falls. Okay, and another one would be, what is convalescent plasma? Okay, so something like that. And we have lots of alumni who contacted COVID, and they shared their experiences on what did the hospital do to them, what are the interventions that they receive, how does it feel to have a COVID. So something like that. And the students really have a very good evaluation of that activity. So I think these are some of the supplements for the clinical learning.
Thank you. That was really helpful. I will contact our alumni, inshallah, and I will request them to do whatever or to share their experience with our students. That was really helpful. Thank you a lot.
Yes, and yes, you're welcome. And I would like to share to you that in the Philippines, we will credit 50% of the clinical hours, okay, using these complementary activities. We are not giving 100% of their grades yet.
Yeah, that's
so 50% will be offered online, but once everything will be fine, so another 50% will be obtained from their actual clinical duty
they
from
have
the
to make
hospital.
up for it.
Yes, they have to make up for it. But of course, learning the concept behind each procedure and learning the scenarios, we can do it online.
Thank you a lot. That was really helpful. Any other question? I will leave the floor.
Menchi mentioned something about telenursing. We're using that also. We're using that. We assigned our students, each of our students, to one patient in the community, but this patient is a well patient. Okay, this is a well patient, wherein the students need to create an online diary on what they need to report their interaction with the patient. What did they advise regarding their diet, the exercise? So they need to monitor that. And for some of the procedures for nursing, we also did that using the family members. So for example, how would you assess this for your family member? So what's the quality of their vitals? So there are some activities that can be done at home.
Thank you. That was really helpful. I will leave the floor for the others if they have any other questions.
I think
Okay.
that's about it.
So I think I need to mention this. Yes, this is true from Joven. Setting a time limit or a well-defined time frame of an assessment or exam using Google Forms could also limit the cheating of our students online. Yes, that is true. So make sure that you have your passwords for your Google Forms. And you should give the passwords around 15 minutes before the time of the examination, because that can be hacked. Right. For example, my examination will be at 1 p.m. So I can adjust my computer time, and I can access the examination. So you need to give the password 15 minutes before that. And you need to have a balance between what is the most appropriate time in answering a specific question. If that is a laboratory question, for every MCQ, that should be 3 minutes. For computational, 5 minutes for every item. But if that is a simple multiple choice question, 1 minute would be fine. Don't give 30 seconds to answer one question. Don't be harsh to your students. What the literature says, regular MCQ, 1 minute. Clinical or scenario-based, 3 minutes. Computation-based, 5 minutes.
Okay. Thank you very much, Dr. Michael, for that very informative question and answer. But of course, we would like to acknowledge your participation, of course, for allowing us to have you as our guest speaker. Although we cannot meet you personally, I will try my best to send this to you. So in grateful recognition of your participation as a speaker, so this is signed by our Dean and Ms. Salma and yours truly. So for this particular session, I think Dr. Michael were able to enumerate a lot of things and a lot of realizations on how we do our online teaching. And the most that I've taken and my takeaway, as they say here in the Middle East, is that it's not actually the technology, but the teacher behind the monitor that is the one that is going to make the difference. So this is quite an engaging session, and thank you so much, Dr. Michael. Any parting words for our faculty members? We hope that we can invite you soon after COVID pandemic is already on its end stage, or when it is possible, because it's actually very nice to allow other people to learn from experts like you.
Definitely, I add that.
Sure, no problem. The pleasure is mine.
Also thank you, Mr. Michael, Dr. Michael, for this informative presentation. And also I thank everyone who joined us today. It was a very enriched information and sharing of experience. And you gave us a lot of resources and stuff that we can actually look at and now explore more into it. Thank you very much for being with us.
Okay, thank you so much. For those who have joined us this time for the webinar session, please check your Zoom chat box. We have sent already the link for your automated digital certificate. For those who registered earlier, you will receive the Google form in your email. So please fill it up with your correct name and your salutation, as well as your correct email address. If you have some troubles receiving your certificate, please do inform us ahead of time. With this, we would like to thank everybody for joining us in this session, Dr. Muna and the rest of our faculty members of the Oman College of Health Sciences branches, our colleagues and friends from different universities in Oman and outside Oman, GCC. Thank you so much for joining us. So be safe, God bless, and take care, everybody.